for the spread of infection. So how do you see that risk? What's the risk inherent in opening schools?
Yeah, I think it's important, particularly as you look at the CDC documents that you referred to. One of the things that we have tried to do is inform people of minimal risk, mild risk, et cetera. So for example, no risk was, or minimal risk is just everybody stayed at home, period. And so obviously if we go to, opening schools 5 days a week, that's going to be a hierarchical risk, okay? It's not to imply that the risk is a prohibitive risk. It's just to allow people to understand how to do their own risk assessment. I think it's really important. Local school districts are going to have to make these decisions. I've said that our guidance that we've put out from CDC, the purpose of it is to facilitate the reopening of schools. I happen to balance the risk here. It's not risk of school opening versus public health. It's public health versus public health. And I'm of the point of view when I weigh that equation as an individual that has 11 grandchildren that the greater risk is actually to the nation to keep these schools closed. A lot of kids get their mental health services, over 7 million in school. A lot of people get food nutrition in school. Schools are really important in terms of mandatory reporting, sexual and child abuse. Obviously the socialization is important, and obviously for some kids, I think actually a majority of kids, they're learning in a face-to-face school is the most effective method of teaching. That said, it has to be done safely, and it has to be done with the confidence of the teachers. It has to be done with the confidence of the parents. And so I think each of the school districts will begin to wrestle with this. I think it is important to try to be factual as we go through this. When we look at right now, the mortality of this particular COVID virus, in the first almost 218,000 people we looked at February to July, there was 52 individuals under the age of 18. And if I recollect, about 35 were actually school age. Some of them were younger than school age. We're looking critically at those individuals, and clearly there's an increase in comorbidities related to significant medical conditions that we've already assumed. But I think that's important, because what that means actually is the risk per 100,000 so far, into the outbreak, 6 months into it, is in fact that we're looking at about 0.1 per 100,000. So another way to say that, it's 1 in a million. Now, I'm not trying to belittle that. I'm just trying to make sure we look at it proportional, because if you do the same thing for influenza deaths for school-age children over the last 5 years, they're anywhere from 5 to 10 times greater. So I want people to understand the risk properly as they make that decision. And obviously influenza, we also benefit from having therapy and a vaccine. So I don't want people to overestimate the risk of serious illness to individuals that are school age. That said, there is a real risk to vulnerable individuals that are teachers, potentially, that may have comorbidities. And obviously there are some students that have comorbidities. So this is not something to do faster than you're ready to do it. It's not something to do if there's not confidence, as I said, of the teachers, who I'm confident are really motivated by the best interest of the children. There is going to need to be accommodation for those teachers that have high risk. Some of our colleagues think it would be a great opportunity for younger teachers in the classroom to be mentored by older teachers by video that may have a risk and should be more separated. But I'm of the point of view that the public health interest of these children is served by getting these schools open. And CDC's job is to work with each school district to help them work through it. As I said, our guidance is not regulation. Our guidance is not in stone. Our guidance is not meant to be impractical. And we have to work with each district as they try to translate that guidance into a functional plan.
So from your